The ER doors burst open and a Navy SEAL commander was wheeled in, his boot cut away, blood soaking the sheets beneath his foot. "Careful," he warned through clenched teeth. "Touch it wrong and I swear." A doctor leaned in. Pain snapped the last thread of control. "Get your hands the air__. Off me," he roared. "Are you blind? Do you idiots have any idea what you're doing?" The room locked up. A nurse flinched. Another stepped back. The injury came from minutes earlier. An award ceremony gone wrong. A steel ramp collapsed, crushing his foot against concrete. Now the anger was all that was holding him together. "Remove before I lose my __. Patience." Then the gurney rolled past a medication cart. A rookie nurse looked up, blonde, calm, unmoved. The commander stopped breathing. "Starlight," he said quietly. Silence swallowed the ER because that wasn't her name. It was her call sign. And nothing in this room was about to stay the same. If you want to know what happens next, leave a comment where you're watching from and subscribe so you don't miss it. The ER had that brittle kind of quiet that only comes right before something breaks. Ava stood at the medication cart counting doses, double-checking labels, keeping her breathing slow. Rookie shift overnight. The kind of hours where mistakes hide in shadows and reputations are made without witnesses. Around her, monitors chirped and carts rattled. The steady heartbeat of a place that never slept. Then the doors blew open. A gurney burst through with a Navy SEAL commander strapped down. His boot already cut away, foot wrapped in temporary gauze that was turning dark too fast. The man's jaw was locked tight, face flushed with pain and anger, metal still pinned crooked to his jacket. Someone said his name. Someone else said award ceremony. Collapsed ramp. Crush injury. Ava clocked the details without looking up. Direction of swelling. Color change at the toes. The way the commander's hands gripped the rails like he was trying to tear steel apart. "Careful," he growled as a doctor reached in. "Touch it wrong and I swear." The doctor leaned closer, trying to adjust the dressing. Pain snapped whatever restraint he had left. "Get your hands the air__. Off me," the commander barked. "Do you know what you're doing or are you guessing?" The room stiffened. A nurse took half a step back. The doctor's mouth tightened. They explained it fast. The ceremony had been held on a temporary stage built over concrete. When the commander stepped forward to receive an award, a steel hinge on the ramp failed. The platform shifted. His foot got pinned between the hinge and the ground. He didn't fall. He didn't even flinch. Until the applause ended. Pride and adrenaline held him up. Then backstage, he collapsed. Now he was here, bleeding, furious, and barely holding it together. "Move," he snapped, breath ragged. "Before I lose my __. Patience." Ava finally looked up. She didn't rush. She didn't interrupt. She watched the way the foot angled slightly inward, the uneven swelling creeping toward the ankle, the telltale pallor that meant circulation was being compromised. She'd seen this pattern before, once years ago, in a place that never made it into textbooks. She cleared her throat softly. "Doctor," she said, keeping her voice level, "if you stabilize the midfoot first, you'll ease the pressure on the vessels." The doctor didn't look at her. "We've got it." Ava nodded once and stepped back. She didn't argue. She didn't insist. She kept watching. Another attempt, another sharp adjustment. The commander roared, a string of curses tearing out of him. "Jesus, stop. You're making it worse." Someone suggested more pain meds. Someone else reached for restraints. Ava saw the toes blanch further and felt a familiar tightening in her chest. She waited. Timing mattered. The gurney rolled forward to clear space, passing the medication cart. Ava was right there when the commander's eyes caught her. He went still. The anger drained out of his face like a switch had been flipped. His breathing slowed. For a half second, the ER felt suspended, like everyone was holding the same breath. "Starlight," he said quietly. It wasn't loud. It wasn't dramatic, but it cut through the room. Ava froze for just a beat. Then she lowered her gaze. "Sir," she said, neutral as a metronome, "you're in a hospital." The doctor blinked. "You know him." The commander swallowed. His voice when it came again was different, controlled, almost careful. "That's not her name," he said, eyes never leaving Ava. "That's her call sign." The word hung there. Call sign. Ava shifted her weight, already moving back into her lane. "Let's focus on your foot," she said. The doctor bristled. "We are." Ava stepped closer anyway, hands gloved, movements deliberate. "If you let me," she said, "I can take some pressure off before imaging." The doctor hesitated. The commander nodded once. "Do it." She repositioned the foot with a technique that wasn't in any protocol binder. Gentle, precise, a sequence learned far from clean floors and fluorescent lights. The change was immediate. The commander sucked in a breath, then let it out. "Pain's down," he muttered. "What did you do?" "Tori stabilization," Ava said. "We need a scan." The monitor beeped steady. Color returned to the toes. A nurse murmured something under her breath. As they wheeled him toward imaging, whispers followed. Who was she? Why did he call her that? Ava returned to her cart like nothing had happened. Fingers steady, eyes back on labels. She felt the looks, but she didn't meet them. Minutes later, the scan came up. The room gathered around the screen. The doctor's face tightened. The injury was worse than expected. Ligament shredded, bones shifted just enough to threaten blood flow. If they'd kept forcing it the way they were, the outcome would have been permanent. Ava spoke once. "That's why it hurt." Silence. The doctor cleared his throat. "We'll need ortho now." As they moved, a commotion stirred near the entrance. Two men in civilian clothes stepped in, posture unmistakable. Military. They scanned the room, eyes sharp, then stopped when they saw the commander. "Sir," one said, relief flashing across his face. The commander nodded back, then tipped his chin toward Ava. "She's the reason my foot's still attached." The men followed his gaze. Ava didn't look up. A senior physician arrived, brisk and skeptical. Who did the stabilization? The doctor hesitated, then gestured. Her. The physician studied Ava. "Name?" "Ava," she said. "Rookie nurse." The man exhaled through his nose. "Of course." They moved fast after that. Orders, calls, consults. Ava was sidelined, told to document and wait. She did. She always did. But as the minutes passed, more uniforms appeared. Quiet, controlled, respectful. They didn't crowd. They didn't demand. They watched. One of them leaned toward the commander. "Sir," he said softly, "is that?" The commander nodded. "Starlight." Ava felt it. Then the shift, the weight of attention settling on her like a spotlight she never asked for. She kept her head down. The senior physician returned, irritation replaced with urgency. "We are taking him up," he said. "Now." As they rolled out, the commander caught Ava's eye again. "You always were quiet," he said. "Still are." She gave a small nod. "You need surgery," she replied. "Good luck." He smiled despite the pain. "That technique," he said, "you didn't learn that here." "No, sir." "Thought so." The elevator doors closed. The room exhaled. Ava went back to work. She didn't notice the way the soldiers lingered, eyes following her. She didn't hear the whispered question that passed between two doctors. She didn't see the senior physician pull up a file, then stop, then look again. What she did feel, clear as a pulse, was the sense that the ER had crossed a line it couldn't uncross. Because somewhere between the gurney and the scan, someone had spoken a name that belonged to a life Ava thought she'd left behind. And by the time the elevator doors opened upstairs, the truth was already on its way back down. The operating floor smelled sharper than the ER, cleaner, colder, less forgiving. Ava stood at a side station documenting vitals as the doors to surgery closed on the SEAL commander. The sudden quiet left room for thoughts she preferred to keep buried. Starlight. She hadn't heard that call sign spoken out loud in years. Not since she traded dust and rotowash for tile floors and fluorescent lights. A senior nurse leaned in. "You okay?" Ava nodded without looking up. "Yes, The nurse hesitated. "They're saying the injury is worse than the scan first showed." "I know how." Ava paused, then answered plainly. "The foot told me." The nurse frowned, unsure what to do with that, and moved on. Down the hall, a cluster of uniforms gathered, men who knew how to wait without looking like it. They spoke quietly, eyes tracking doors, clocks, people. One of them glanced at Ava and looked away just as fast. Another didn't. Word travels fast in hospitals. It travels faster among soldiers. A doctor approached Ava with a tablet. "We're reviewing your stabilization notes," he said, tone careful. "Now, where did you learn that sequence?" "Overseas," Ava replied. "Field medicine." "That's not an answer. It's the honest one." He studied her face, searching for bravado and finding none. "The commander recognized you." Ava kept her voice even. "He's in pain. People say things." The doctor almost smiled. "He didn't say your name." "No." "Then what did he say?" Ava met his eyes for the first time. A word that helped him stay alive once. The doctor walked away unsettled. Minutes stretched. A monitor beeped. A door opened and closed. Ava finished charting and checked supplies, hand steady. Inside, something old stirred. She remembered a night with no moon, a radio crackling, blood soaking into sand. She remembered kneeling just like she had in the ER, watching a man breathe and deciding how much time he had left. She pushed the memory down. This wasn't that place. She wasn't that person anymore. A young resident approached, curiosity getting the better of him. "Is it true?" He asked about the call sign. Ava didn't answer. "His intense." The resident added. "He tore into Dr. Haynes before he saw you. Pain strips filters." Ava said, "It doesn't change character." The resident nodded, then blurted, "What does Starlight mean?" Ava closed a drawer. "It means you don't panic when the lights go out." A page crackled overhead. The surgery was progressing. The tension in the hallway shifted, less frantic, more focused. One of the soldiers stepped closer to Ava, careful not to crowd her. He said quietly. "He wasn't kidding in there." "I know. He hasn't used a call sign in public ever." Ava's jaw tightened. "He shouldn't have." The soldier lowered his voice. "With respect, He said it because he trusted you." Trust. The word landed heavier than any accusation. Ava returned to her notes. Another hook snapped tight when a senior physician, Dr. Alvarez, arrived. She was known for cutting through noise. She reviewed the chart, then the scan, then Ava's notes. "You stabilized before imaging," she said. "Yes. You reduced vascular compression." "Yes. That technique isn't taught here." "No." Dr. Alvarez looked up. "Where did you learn it?" Ava took a breath. "From people who didn't have imaging." Dr. Alvarez studied her, then nodded once. It worked. The doors opened. The surgeon emerged. Mask pulled down. "We are done," he said, foot's intact. "We caught it in time." Relief rippled through the hall. The commander was wheeled into recovery. His face was pale, sweat beading at his temples, but his eyes were clear. He spotted Ava instantly. "Hey," he said voice. "You still here?" "Yes, sir." "Good." He swallowed. "You always were." A doctor tried to intercept. "Sir, you need rest." The commander waved him off. 1 minute. He looked at Ava. You saved my foot. Ava shook her head. The team did. He smiled faintly. You don't change. Recovery hummed. Orders were given. Ava stepped back, returning to the edge of things. That's where she preferred to be, but the edge was shrinking. Dr. Alvarez approached again. We need to talk about the patient. About you. Ava waited. Your documentation. References field protocols. Alvarez said. Unconventional ones. They're effective. They're also specific. Ava's eyes flicked to the soldiers nearby. I don't advertise. Alvarez lowered her voice. You don't have to. People are noticing. The commander's team gathered at a respectful distance. No demands, no spectacle, just presence. Another hook tightened when the hospital administrator arrived, drawn by whispers and uniforms. What's going on? She asked. Successful surgery, Alvarez replied, and a nurse who recognized a problem early. The administrator looked at Ava. Name, Ava. Last. Ava hesitated. It's on the badge. The administrator read it, then glanced at the soldiers, then back at Ava. We'll talk later. Ava nodded. In recovery, the commander shifted, wincing. Doc, he said to Alvarez. She knew before the scan. Alvarez met his gaze. She did. You should listen to her more. Alvarez smiled. I plan to. The commander's eyes returned to Ava. Starlight, he said softly like a promise, not a reveal. Still watching the dark, Ava's throat tightened. She answered the only way she knew how. Focus on healing, sir, he chuckled, then winced. Yes, As the team dispersed, Ava felt the weight lift and then settle again. Heavier. Being right had a cost. Being seen had a bigger one. She went back to work. An hour later, a nurse whispered, They're asking about your background. Ava didn't look up. They always do. Not like this. Ava finished a note, tapped her pen, and straightened. If they ask, tell them I'm on shift. The nurse nodded. Near the elevators, the soldiers stood in a loose line. One of them caught Ava's eye and gave a small nod, acknowledgement without intrusion. Ava returned it and moved on. By the time her shift neared its end, the ER had settled. The adrenaline faded, leaving space for consequences. Ava knew they were coming. She'd learned that long ago. She paused at the medication cart one last time, breathing slow. Rookie nurse. Starlight. Both true, neither complete. Down the hall, doors opened. Footsteps approached. Dr. Alvarez's voice carried, measured, and calm. Ava, she said. We need you. Ava turned ready. Before we move on, have you ever been underestimated because someone didn't know your past? The conference room on the 4th floor had no windows. It was designed that way. Privacy, control, no distractions. Ava noticed it immediately. Rooms without windows always meant decisions were about to be made without sunlight. She took the chair nearest the door. Old habit. Dr. Alvarez sat across from her, tablet in hand. To her right was the hospital administrator, Miss Clean, posture rigid, expression unreadable. A man Ava didn't recognize stood near the wall, arms folded, suit too sharp for a hospital, military bearing, hiding under civilian cloth. That was the first shift in the air. Thank you for coming, Ava. Miss Klein said, This won't take long. Ava nodded. I'm still on shift. We are aware. The man by the wall spoke next. For the record, this meeting is informal. Ava looked at him. Informal meetings don't usually have escorts. Dr. Alvarez hid a smile. The man exhaled once, slow. Fair. Miss Klein leaned forward. We've had several inquiries about today, about you. Ava waited. Silence was a tool. She'd learned that long before Scrubs. The SEAL commander, Clean continued, made a statement in recovery. Ava didn't react. He insisted that you be present for any follow-up, Alvarez added. He also requested your full service history. That landed. Ava felt it settle in her chest, heavy, but expected. That information isn't relevant to my nursing duties. The man by the wall finally unfolded his arms. It is when it intersects with classified operations. There it was. A second hook tightened when Miss Klein slid a printed page across the table. It wasn't hospital letterhead. It was older government stock. Ava didn't touch it. You stabilized him using a technique not recognized by civilian protocol. Klein said you anticipated compartment syndrome before imaging. Yes, you knew where to apply pressure. Alvarez said. Exactly where? Yes. The man's voice dropped. That technique was used by naval special warfare medics in joint operations. Ava met his eyes. Medics and surgeons. He nodded once. Call sign. Ava didn't answer. Alvarez looked between them. She doesn't have to. She doesn't. The man agreed. But the commander already did. The room went quiet. Miss Klein cleared her throat. He spoke it aloud in recovery in front of witnesses. Ava closed her eyes for half a second. Not fear. Calculation. Starlight, the man said gently, almost respectfully. You were hard to find. Ava opened her eyes. I wasn't hiding. You disappeared. I finished my service. Alvarez leaned forward. Ava, who are you? Ava looked at her. Really looked. Someone who did their job. The man placed a small device on the table. Not a recorder, a badge, no name, just an emblem. Naval Special Warfare, third hook. We are not here to expose you, he said. We are here because the commander's injury wasn't an accident. That cut deeper than any accusation. Alvarez stiffened. What do you mean? Stage collapse, the man replied. Awards ceremony. Structural failure. But the damage to his foot wasn't consistent with a fall alone. Ava felt the old instinct surface, sharp and unwelcome. Crush injury. Localized, he said. Targeted. Miss Klein's voice was tight. Are you saying? I'm saying the commander was lucky someone with battlefield experience was on duty. Alvarez looked at Ava differently now. Not curiosity. Respect edged with concern. You recognized it because you've seen it before. Ava nodded once. Too many times. The man turned to her. We need you to consult. Ava didn't hesitate. No, that surprised them. I'm a nurse here, she continued. That's my lane now. You're also the only one who can read the signs we are seeing, he said. And the commander trusts you. Ava's jaw tightened. Trust was a weapon when wielded wrong. Dr. Alvarez spoke carefully. Ava, if there's a risk, there's always risk. Ava cut in. That doesn't mean I cross lines I worked hard to leave behind. Silence again, thicker this time. Miss Klein finally said, We are not forcing anything, but you should know. There are people asking questions outside this hospital. Ava stood. Then you should answer them. The man watched her. You're still the same. Ava paused at the door. No, I just remember who I am. She left before they could stop her. Downstairs, the ER buzzed like nothing had happened. That's how it always was. Lifts pivoted in quiet rooms while the world kept moving. Ava washed her hands longer than necessary. Water grounded her. A nurse whispered as she passed, The soldiers are still here. I know they are asking for you. I'm charting. The nurse nodded, unsure, and moved on. Ava finished her notes with care. Every word mattered now. When she finally stepped into recovery, the room stilled. The SEAL commander lay propped up, boot off, foot wrapped, eyes sharp despite the pain meds. His team stood at ease nearby, pretending not to watch her. He smiled when he saw her. You came. I'm working. Always were. He shifted, wincing. They told me you didn't want to consult. Ava met his gaze. They told you wrong. His smile faded. Good. He lowered his voice. Someone wanted me hurt. Ava nodded. I know you saw it. Yes. They won't stop. No. He studied her face. You still walk away. Ava took a breath. This was the hardest part. I don't run toward ghosts anymore.